64-year-old man involved in motorcycle accident and found to have fracture affecting the anatomical neck of the humerus, which is displaced. So first of all, the fracture occurs in the anatomical neck. The second one, it is the displaced fracture. What is the most important management? Here are the options. Options are: place a collar cuff for 3 weeks, then commence physiotherapy, hemiarthroplasty; place a collar cuff for 6 weeks and then commence physiotherapy; reduce the fracture and place an arm sling with repeated imaging at 14 days; reduction under anesthesia and place in collar and cuff system for 6 weeks. So they are the options, and what may be the treatment option. So here this is showing a fracture of neck of the humerus, and it is the anatomical neck. Here we can see this area is the anatomical neck, and here there is a fracture in the anatomical neck. So as there is a fracture of the anatomical neck and it is displaced, so the most dangerous thing there is it is displaced. So the scenario is different, and there is surgical neck also in this area. This is the surgical neck. And keep in mind that in anatomical neck fracture, there is management always surgery, maximum time surgery. And in case of surgical neck fracture, there is the conservative treatment. So during anatomical neck fracture, there is compulsory for the surgery, and in case of surgical neck fracture, this is conservative. So we have to keep in mind this situation, that in anatomical neck fracture always go for surgery, anatomy surgery. So the anatomical neck surgery, surgical neck conservative treatment. And here we can see the proximal humerus fracture in details. This is very common type of the injury following road traffic accident, or following any type of fall from height, or any other type of the injury. The proximal humerus is the most vulnerable point, usually through the surgical neck. So the surgical neck, as the management is always the conservative, and the surgical neck fracture very common, and anatomical neck fracture, it is not so much common. But it is rare fractures through the anatomical neck. So through the anatomical neck, it is rare. It occurs when there is the direct force, or there is a huge force on the anatomical neck. Anatomical neck fracture which are displaced by 1 centimeter carry a risk of avascular necrosis of the humeral head, as there is a chance of development of the avascular necrosis in the humeral head. For this condition, in displaced anatomical neck fracture, we should always go for the surgery. In children, the commonest injury pattern is green stick fracture through the surgical neck. So green stick fracture through the surgical neck, it is managed by conservatively. And impacted fracture of the surgical neck are usually managed with the collar and cuff. So this is the managing point. That means the surgical neck fracture, usually it is done by the conservative treatment, that is collar and cuff for 3 weeks followed by physiotherapy. And displaced fracture may require open retraction and internal fixation and use of intramedullary nail. So any type of displaced fracture usually required surgery. There is less chance of recovery by the conservative treatment. So what will be our option? As it is anatomical neck, so go for the surgery, and also it is displaced, so there is no option for conservative treatment. So the displaced anatomical neck fracture, the only answer is the operation, which is the hemiarthroplasty.